Picture this. A physician treats a patient for a biological disease, completely cures the immediate symptoms, and then sends them right back out into the exact same environment that made them sick in the first place. So you have to ask, did that physician actually finish the job? It's a pretty provocative thought, right? Historically, we've always looked at health through this really strict, narrow biomedical lens. Fix the biological abnormality and boom, you're done. But what happens when our biggest health challenges, things like severe malnutrition or complex chronic illnesses, literally can't be solved by just pulling out a prescription pad?
Welcome to this explainer. Today, we're completely ditching that top-down savior complex. You know the one, where outside experts parachute in to just fix things. Instead, we are mapping out a massive, much-needed paradigm shift in public health. We're going to give you a very concrete roadmap, the 6 essential steps for authentic, ground-level community engagement.
So here is our roadmap for today. First, the saviors versus partners. Second, defining the community. Then, preparation, immersion, action, and finally, true community empowerment. Let's get right into it.
Starting with Section 1, the saviors versus partners.
Think about the traditional, classical biomedical model for a second. It is highly individualistic and very top-down. The focus is almost exclusively on the pathogen or the pathology, and the community, well, they're basically seen as just passive recipients of a clinical prescription. It's like a hospital just dropping a cure from above and hoping for the best. But compare that to the community engagement model, which is deeply rooted in primary healthcare. Now the focus shifts to the collective social body and the social determinants of health. It's about growing a solution from the roots up, not the top down. It's a fully participatory approach, where the community isn't just some passive patient. They are an active co-creator. They're a partner in actually solving their own challenges.
There's this fantastic quote: "Data tell you what is happening. Communities tell you why." And it's so true. I mean, you can stare at epidemiological charts and spreadsheets all day long to see a spike in a disease, but until you actually sit down and collaborate with the people living through it, you are never going to understand the underlying causes. You just won't know if the real issue is a lack of transportation, or seasonal agricultural work, or even local health beliefs.
Which brings us to Section 2, defining the community.
A community is definitely not just a zip code or a spot on a map. It's a living, breathing, dynamic social system. Think about a really tight-knit village, what sociologists call a Gemeinschaft, which is driven by face-to-face bonds, deep kinship, and shared traditions. Now contrast that with a bustling, modern city, a Gesellschaft, which is mostly built on impersonal, bureaucratic, and self-interested transactions. You absolutely cannot use the same engagement strategy for both. You have to tailor your approach to the specific social fabric of whoever you're working with.
And that brings us to our master game plan, the 6-step continuum. We're actually merging the pre-entry and entry phases into one single, highly actionable roadmap, taking us from institutional prep all the way through to core group formation. Let's break these down step by step.
Moving into Section 3, Steps 1 and 2, Preparation.
Think of this in medical terms. Entering a community without doing your prep work is literally exactly like prescribing heavy clinical treatment without ever taking a patient's medical history. Just as a good doctor would never hand your pills without knowing your actual symptoms, a public health team should never, ever launch a program without fully understanding the community's context, their history, and the resources they already have. Doing that just risks totally alienating the very people you're trying to help. So step 1 is basically looking in the mirror, institutional preparation. You've got to audit your own team's resources and completely ditch that top-down charity mindset. You need to align your staff toward a true partnership paradigm instead. Then, step 2 is site selection and the data audit. This is doing your homework. You review the hard numbers, census records, local health board reports, to make absolutely sure you are picking a site objectively based on real need. And crucially, this ensures you aren't just duplicating the efforts of some other organization that's already out there on the ground.
All right, Section 4, Steps 3 and 4, Immersion.
Communities do not open their doors because of our credentials. They open their hearts because of our character. Man, this is essentially the golden rule of the entry phase. You could have a wall full of Ivy League degrees and millions in funding, but if you walk into a community with arrogance, you are going to fail. A respectful, totally transparent entry is what actually builds the psychological safety and mutual trust that you absolutely need for any sustainable success.
This whole idea is beautifully grounded in a rich concept from the Philippines called Pakikipagkakapwa-tao. Basically, it translates to a shared identity or shared humanity. It means you stop treating people as the other or as strangers, and you certainly don't treat them as mere research subjects. You treat them as equals. That deep, shared empathy really has to anchor a practitioner's entire approach to integrating with a community.
So practically, step 3 is the courtesy call. This is shaking hands with the mayors, the council members, the formal gatekeepers, but also the respected informal leaders like community elders. But step 4, immersion, is where the real messy work happens. You don't just pop in for an hour visit, you live there. You fetch water, you chat at the local neighborhood store. You literally live their daily reality and adopt a very low-key profile so you can truly integrate.
Which naturally leads us to section 5, steps 5 and 6, action.
Once you're integrated, to organize strategically, you really have to map out the local power dynamics. A great way to do this is using an influence interest matrix. Notice your key players, the folks with high power and high interest. Those are your active partners. Then you've got your context setters, high power but low interest. You just need to keep them satisfied so they don't block what you're doing. But look at the subjects. These people have low power but very high interest. They are often the most marginalized people in the community, but they possess the deepest, most authentic experiential knowledge. Ultimately, empowering them is your biggest goal.
Step 5 is deepening social investigation. This basically means closing the laptop and hitting the pavement. You do physical transect walks, literally walking through the neighborhood side by side with locals so you can observe environmental hazards or sanitation issues in real time through their eyes. From there, you move to step 6, core group formation. This is where you identify the natural, respected opinion leaders, especially seeking out those traditionally marginalized voices we just talked about. They become the organizing engine that will actually lead the community's action plan.
And finally, section 6, true community empowerment. You know, we hear the buzzword cultural competence all the time, this idea that you can just study a checklist of customs and somehow master a culture. But really, what we should be striving for is cultural humility. It's a lifelong commitment to self-evaluation and self-critique. It's not just about memorizing someone else's beliefs. It's about having the humility to actively fix the power imbalances between the professional and the community. It's being brave enough to admit, hey, I don't have all the answers, and placing deep trust in local expertise.
These 6 steps we've explored today, they aren't just administrative checkboxes. They represent a really profound shift in how we fundamentally relate to one another. It's all about building genuine trust, sharing power, and co-creating solutions that actually last. So, as you look at your own work, no matter what field you happen to be in, you really have to ask yourself, are you ready to stop being a savior and start being a true partner?